we live into our 80s now. You shouldn't have to stop being a sexual being at 50.
I'm Jill Angelo, host of the Geneve podcast series for women's health in midlife. I speak with the most forward-thinking experts in the health and wellness industries. These experts are helping women 40 plus feel confident and in control of their health in the most vibrant years of their lives. So join us on this journey of women's health. A lot of women deal with painful sex and some incontinence, and there haven't always been great options for dealing with these issues. Topical hormones work well for vaginal atrophy, but some women can't and don't want to use hormones. Fortunately, now there's the Mona Lisa touch. According to Seattle OB-GYN, Dr. Rebecca Dunsmoor-Su, the Mona Lisa touch laser treatment can return vaginal tissue to its pre-menopausal state in just a few short treatments. In this podcast, she explains how it works and why it's making such a positive impact on women's lives. I'm thrilled to have Dr. Rebecca Dunsmoor-Su here with us today. Thanks for joining us.
My pleasure.
Well, first of all, so we're talking about the Mona Lisa touch, yes. Which is a newer procedure in women's feminine health. Before we get there, because it's something a lot of our listeners and Geneve community members have asked about. So this is a hot topic,
okay.
Literally kind of.
Yeah.
But before we get there, let's talk a little bit about you. How did you get to where you are now and focusing on bringing the Mona Lisa touch to women everywhere?
Well, there's the long version and the short version of that. So I'll give you the short version. I went to a women's college on the East Coast and was always interested in women's issues and women's health, but was not planning to go to med school. And then after graduating college, sort of reevaluated where I was going and decided that was my goal. So when I entered med school, I already had an interest in women's health and really was sort of focused on heading that direction. I actually early on thought I might go into surgery or a surgical subspecialty, but when I did obstetrics and gynecology, I really discovered it's a wonderful blend of continuity of care for women and all the surgeries and procedures that I enjoyed doing and I was very good at. Mm-hmm. So that's sort of how I landed there. I moved out here in 2005 to Seattle from the East Coast and took a job at the University of Washington as faculty and was there for about 8 years, teaching and practicing medicine. And then in 2012, 2013, decided I just needed a change, a different sort of style of life. And so I moved to sort of an inpatient hospitalist practice. And after doing that for a while, I realized I loved what I did, but I was missing sort of working with women in an office setting, working with women who were beyond their reproductive years, and sort of started looking into Mona Lisa touch because there weren't a lot of options for women I was seeing who had breast cancer or who, for other reasons, just weren't comfortable with hormone use.
Yeah.
And I felt like they really deserved to have options for having an active sexual life in menopause.
And so, yeah, the real connection there is you were looking at women as they kind of matured beyond their post-reproductive years, yes, and having a fulfilling sexual life, sexual
right.
wellness and sexual life.
We live into our 80s now. Mm-hmm. You shouldn't have to stop being a sexual being at 50.
And the treatments associated with breast cancer and with the hormone change, mm-hmm, associated with aging, they all impact how our vagina and how our body accepts sex or any kind of stimulation.
Absolutely. Some women will never have an issue with this. Mm-hmm. And when you look at all the large-scale studies, they show that about 50 to 54% of women in menopause will have issues in the vaginal region where it's either the itching and burning just day to day or pain with intercourse.
Yeah. So let's get to the Mona Lisa touch.
Okay.
You obviously looked at that as an alternative because other alternatives are like hormone treatments. Yeah. And a lot of women just can't go there. So tell us a little bit about how you counsel women first through this process of, I don't think I want to do hormones. What are the alternatives?
So I think the first thing that's important to say is that hormones are a good treatment, and local hormone works really well for vaginal symptoms.
And when you say a local, does that mean topical or ingested? Okay.
So I always start with topical. If we're dealing just with vaginal symptoms, there's no need to use a systemic hormone and take the risks associated with that. Systemic hormones are fantastic for hot flashes, and they're fantastic for people who really need it for bone health. But when you're talking about vaginal symptoms, we can treat them well locally.
And that keeps the hormones just local to that area versus moving throughout the body.
You know, it's interesting, and when we look at how sort of blood flows in the pelvis, if you're treating just the lower 1/3 of the vagina, there's very little likelihood you're going to absorb much of that hormone systemically. And really, when women are having pain with intercourse, they're having pain in the outer part of the vulva and the vagina. The upper part of the vagina might be a little bit sore, and you might need to treat that too, but generally, the bulk of your nerve endings are on the outside.
Okay.
So I always start the conversation with, are hormones an option for you? And for some women, they just don't want to, or they've tried them and they find them messy. And for some women, especially women who've had breast cancer or uterine cancer, they don't like the idea of putting hormone in their body at all, which I completely understand. Despite studies that say it's probably safe, I can understand why you would be hesitant at that point. And then we start talking about, well, what else do we have to offer you? And the answer is very little. There are personal lubricants, which do not contain hormone, and there are sexual lubricants, which can be helpful, but I find that if the tissues are thin and are causing pain, even adequate lubrication sometimes can not be enough. And that's when we address using the Mona Lisa Touch, because what it does is it really brings those tissues back to full thickness and hydration status, and really so that they're feeling pre-menopausal without having to use a hormone.
So start by describing what the device looks like, because it's a device and it's a procedure. So
yes.
A woman needs to do this multiple times. So walk us through what that procedure and what the device is like.
So the device itself looks like sort of a tall, narrow Xerox machine, really, with a screen, and has a big arm and a probe that looks, if anyone's ever had a vaginal ultrasound, it's very much a similar probe. We use that on the inside. And then a spacer probe on the outside, which just sort of spaces the laser the correct distance from the skin. It's got two sort of metal prongs that are about an inch long that hold it back off the skin.
Kind of like when you go in for x-rays on your teeth.
Exactly.
It's the same.
Yeah, that same type of a spacer to keep it at the right distance. And so what happens when you come in for the procedure? Well, first of all, women need to get the procedure done when they're starting this. They need to get it done 3 times at 6-week intervals. So we treat 3 times. The first time is a little bit shallower to sort of get the beginning of the process started. And then the second and the third time we go a little bit deeper because the tissues have already started to improve and we can do a slightly deeper treatment. Those 3 treatments are really meant to last a year. Although I've found in my practice that occasionally women need a touch-up at maybe 6 to 9 months. And that's sort of a judgment call. Every woman's just a little bit different.
And you'll know if you need that touch-up if the
things
pain
start to return. The symptoms that you came to me for start to come back. Then you just give me a call and come in and we do a touch-up.
How does the Mona Lisa Touch laser work?
So the way the Mona Lisa laser works is that in mucous membranes, you have sort of a basal layer of cells and then a topical layer of cells. In menopause, the basal layer is about 1 cell layer thick, and there's a very thin topical layer above it. When you treat with the laser, it actually reawakens cells in that basal layer called fibroblasts, and they start making hyaluronic acid. They start rebuilding the tissues themselves. So by the time you're done treating, you actually have 3 to 4 basal layers of cells and this huge... it's easiest to show with a picture, and there is actually a picture on my website, but you have multiple layers on top of that, so it's much thicker tissue. You regenerate the normal acid that makes the pH of the vagina lower, so it brings back the normal bacteria. The topical layers do something called sloughing of glycogen. Basically, they release glycogen into the vagina, and the bacteria live off that glycogen, the lactobacilli. That's why they like to live there. So, and it does also bring in blood vessels again and rehydrate those tissues. All these things are happening when you reawaken those fibroblasts in the basal layer of the cells.
It sounds like a little party
going on.
It is
kind of a little party.
But you know what I love about so many of those terms that you just took us through? Again, for anyone who's had any facial work done, or laser work on the face or what, many of these same rejuvenation techniques are happening in our skin in any part of the body.
Absolutely. It's really just telling the body to restart a system that it was using before. It's the reason that it works really well in women who are 10 or fewer years from menopause. It works pretty well in women sort of 10 to 20 years from menopause. But after a while, it's hard to wake those tissues back up.
So it's better to kind of, as soon as you start to experience some of the symptoms and you notice a change happening down there,
Absolutely.
check it out.
Absolutely. It's easier to reawaken tissues when they haven't been asleep as long. And I tell patients, the one other group of patients with whom we're never sure if it's going to work are anyone who's had radiation in the pelvis, because if those cells have died, we can't reawaken them. And I have a few patients in my practice who've had radiation treatment, and we just try. We try it once, and if they get no effect, then we stop. But, sometimes those cells are ready to be awakened even in those patients.
If you're not sexually active, so you're not experiencing pain, but you've got itchiness and whatever, would the Mona Lisa touch be a suitable option?
Absolutely. What it does is the tissues inside the vagina and outside in the vulva in menopause tend to get very thin. They aren't as well hydrated. They don't tend to be as well lubricated, and that's what causes all those symptoms. And what the Mona Lisa Touch is just return them to where they were prior to menopause. So certainly for those symptoms, it's absolutely a good choice. And again, estrogen is good for that as well. But if that's not an excellent option for you, then Mona Lisa Touch definitely works for that.
That's great. So on the procedure, you started to say that you start shallow and then you go deeper. And shallow means it's just in the first third of the vagina, vaginal opening?
In terms of shallow, I mean depth penetrating into the actual tissue. So we set the laser differently for the first treatment and the second and third. And it actually penetrates just a little bit deeper. At all three treatments, I treat the entire vagina and the outside vulva.
And does it hurt?
It does not hurt in the vagina. The vaginal treatment feels sort of like a buzzing. The vulva treatment would be painful, but what I do is I have my patients place some numbing cream on the outside about 5 minutes before treatment. And so, there might be a little slight stinging, but at the time of the treatment, generally it's relatively painless.
Would it be analogous to if you've had laser treatment to laser hair removal?
I find that it's less painful than that.
Okay, that's a great barometer, I think, because a lot of women know what that feels like.
No, absolutely. I think it's less painful than laser hair removal, especially with the numbing cream. There are symptoms for about the first 24 to 48 hours, and what I usually tell women is it feels sort of like a sunburn, like you got a sunburn down there. And most patients I treat don't take anything for that. They might use some ice packs for the first day or so.
That's not so bad.
It's not terrible.
Is there any peeling of the skin or anything, flaking or anything like that?
No, nothing like that. So I think a lot of people think of carbon dioxide laser resurfacing of the skin. That goes a lot deeper, and so you do get some flaking and peeling of the skin when that happens, but we don't do it nearly that deep in the vulva and the vagina. So you don't get any peeling or flaking of the skin. The most common thing I've heard is a little bit of watery discharge for about a day. And every once in a while, someone will have some spotting when I've done it. That's most commonly because their tissues are so thin that just having the probe inserted causes some spotting.
Yeah. What do you think is the biggest thing that holds women back from doing the Mona Lisa Touch treatment?
I think cost is a big issue.
Let's talk about that. How much is it?
So in my practice, I charge $2,000 for the first year, and that's the 3 upfront treatments and any treatments you would need during that first year. And then the yearly touch-up that I recommend, I charge $300 for the first 2 years and $500 after that, which sounds like a lot of money because it is a lot of money. What I tell women is that, if you're paying a copay on your estrogen or an S-string, say, if you're using that, it's almost as much money.
Yeah, is this just talking about copays and insurance? This is not covered. This is totally
entirely not covered by insurance. If you know anything about medical billing, every procedure we do has what's called a CPT code so that we can submit it to insurance. They've never assigned a CPT code to this. They consider it aesthetic.
Sure.
I would argue with that.
Yeah, I think every woman who needs it would argue.
But, we're fighting a larger fight in terms of how women's sexual health is prioritized.
Yeah.
And I would not hold my breath about this being covered by insurance, unfortunately.
Well, when you break it down, $2,000 in a year, if you get any sort of regular facial treatments or things like that, it's just kind of it's another thing to consider in that realm.
It certainly is. And, as we try every year to make it a little bit cheaper, it's hard. The device itself is actually very expensive and the startup is quite high. So that's why, there's a balancing act. We have to sort of make sure that we cover our costs.
Yeah. Yeah. So cost aside, in terms of the psychology and the fears and, associated with a procedure like this, are you finding that women are relatively open to it, or do you have to do a lot as a physician to kind of help ease them through it?
I think the women who find me and who come for it already know they want it. And they've done a lot of research online. And I think what I find is the first time people tend to be a little hesitant and a little fearful of how it's going to feel. And once we get done, because it takes all of about 5 to 10 minutes to do, once we get done, they sort of look at me and say, that's it? That's all? I say, yeah, that's really it. That's all we have to do. And then it's no problem.
So if I come in for a procedure, how much time does it take?
So the first visit, I usually spend about 45 minutes. And we talk, we go through consent, we go through the pluses and minuses and how it works. And then we do the first procedure that day. The actual procedure itself really only it's about 5 minutes for the numbing cream to work and about 5 to 7 minutes for me to do the whole procedure.
Okay. Very brief.
Yeah.
That's great.
So the second and third time, people I only schedule them in for 15 minutes. If they have questions, we can address that while the numbing cream is working and get them in and out.
And how do women find you?
I'd say primarily online. I started doing this in 2016. And was the first gynecologist in Seattle to do this. It just hasn't made it out here to the Seattle market as much. And so when I first put up a website and put myself on, one of the websites, I believe it was Real Self, suddenly calls started flooding in. Oh, you're doing this in Seattle. That's wonderful. I think there's another gynecology practice that does it now.
Okay.
I know there are a few urologists who do it, and that's because it also works great for incontinence.
So incontinence, burning, itching, pain.
Pain with intercourse. I think I personally was surprised at how well it works for the incontinence issues, because that wasn't really why I started doing it. And I'd seen what data was out there, but really wasn't sure how much this could do.
And how does it work with the incontinence?
So I think it's a combination of effects. I think some level of incontinence in menopause is because women have abnormal bacteria in the vagina. So they're getting sort of low-level urinary tract infections, and it completely reverses that effect. The bacteria go back to the normal lactobacilli that we like to see in the vagina. The pH goes back to normal, and so that goes away. I think it also bulks up the tissues around the urethra. So it helps you control stress incontinence and a little bit of that urge. It gives you that 5 minutes to get to a bathroom when you feel the need to go.
That's great. So I bet has that brought your audience age down? Because I know women, post-baby, you will suffer from that. What's the age kind of range that you're serving?
So I treat primarily postmenopausal women.
Okay.
However, I will say that in training to do this, I was working with a physician in Los Angeles, and he does more and more pre-menopausal women post-baby for the incontinence issues. And he says it really does help, even though the tissue should be healthy and normal. It just helps to bulk up those tissues around the urethra and really give them more time. There are great surgical procedures for incontinence, but if you have very mild incontinence and really aren't ready for a surgery, this is a great alternative option to sort of get you through 5 or 10 more years. And every once in a while, I will see a patient who is between babies, breastfeeding, has the breastfeeding, lack of estrogen, and all the same symptoms as a postmenopausal woman. Doesn't want to use estrogen for whatever reason, and it's a great option for that too.
That's great. How about you as a practicing professional? So you're offering the Mona Lisa Touch. Are you also a full-on OB/GYN as well? Do you have, can I be your patient 360 degrees of my health, or how are you?
Unfortunately, not yet.
Okay.
So when I made that transition back in 2013, I became what's known as an OB Hospitalist. So I'm employed by one of the practices at Swedish Medical Center, and I basically for 24 hours at a time live in the hospital and help with labor and delivery, emergency calls from the emergency room, back up other doctors, help them do C-sections, just sort of function sort of as a safety officer because it's a very busy, very active labor floor. That's my main job, so to speak. That's what pays my bills and supports my family. This practice I started as a side business because, as I said, I missed seeing this other sort of patient. So right now, I don't have insurance contracts with this business. I just see Mona Lisa Touch patients. I'm happy to talk about all those other things when we're having the visit, and certainly I'll prescribe pelvic physical therapy, or if someone needs like a medication refill, I'll do that if they're my Mona Lisa patient. I'm hoping long term to develop a menopause practice and sort of drift into that over the long term. But I'd say right now it's sort of a work in progress.
That's fantastic, though. Wouldn't that be amazing if a woman could come into a practice and it kind of addresses, so many aspects of her menopausal health that she's experiencing? I think that's fantastic.
It's my goal. It's a population I love to work with. It's hard in today's medical environment because unfortunately not much that we do in menopause pays the bills particularly well. As an obstetrician gynecologist, people support their practices with OB, with obstetrics.
Because there's always babies.
There's always babies
being born.
It's a set amount of money you'll be paid to take care of a woman in her pregnancy, and it's something you can sort of balance the books with. Menopause takes a lot of time and a lot of care, but there's not a lot we do. And so, I don't know how much your audience knows about how we bill in medicine, but we often bill based on the complexity of a visit. But complexity is not determined by me.
Right. Absolutely.
And if I didn't physically do something that I can write down and submit, it's considered a less complex visit. It doesn't matter how much, we just needed to talk. There's some billing that you can do based on time. But, it's always a much more complex practice to put together and make viable.
Yeah. It's simply because I know what we hear from a lot of women in our Genève community is, I'm not quite sick enough to go to the doctor. I don't know if I'm sick or not, or does this warrant me going to see a physician? And I think that just underscores your point that it really starts with a conversation, and it's much more, it's a lot of lifestyle, but there's obviously complex procedures and, things that women can do to feel better if they're suffering from any symptom of menopause.
That's true, but I think, the biggest part of any visit in menopause is just talking. There's a lot it's a huge transition. Emotionally, physically, hormonally, all those things, don't necessarily need to have anything done about them unless people are symptomatic, but it's still a huge transition that needs to be talked about. And as a woman ages and transitions into different phases of her life, there are different things she needs to be aware of and be looking out for. And that type of counseling is very interesting to me. I enjoy it. But as I said, it's not what pays the bills of a medical practice necessarily. It's why most obstetrician gynecologists do full spectrum, so they can see those patients as well as everything else.
So for women who find you to do a Mona Lisa Touch procedure, what's kind of the next step? Do you schedule an appointment and they come in, or is there any kind of pre-procedure work that they need to do?
So when they call, we schedule them an appointment to come in. I send out some basic paperwork, health history forms and things like that. But I always try to point women to my website, and which we're building slowly over time. But what we've done is put a lot of different information on there. What does the procedure do? How does it work? We have a information page for the physicians if their primary care doctor wants to look at the procedure and find out about it. I'm slowly starting my own blog that's just basic menopause facts from a medical perspective. You can find menopause facts all over the interwebs, as we like to say.
Yep.
Not all of them are necessarily based in science.
Yeah.
And, what my training has taught me is how to look into the science of things and understand what we know, what we think we know, and what we don't know.
That's fantastic. And again, can you repeat your website address for our listeners?
So my website is RenuvaGyn, which is RenuvaGyn.com.
RenuvaGyn.com. And we'll post that on the blog associated with this podcast as well. Well, thank you, Dr. Rebecca. Appreciate you coming in to talk to us about this incredible procedure. Thank you for doing it in Seattle and pioneering it. Thank you.
Thank you so much for having me.
Thanks so much for listening to my conversation with Dr. Rebecca. You can learn more about her and the Mona Lisa Touch treatments at her website, RenuvaGyn.com. That's RenuvaGyn.com. Next up, just in time for Halloween, Dr. Anna Garrett tells us why sugar truly is addictive and how to kick the habit. In fact, I'm taking the challenge. So join me. Hear the podcast and then join us for a Facebook Live chat with Dr. Anna on Halloween Day. Check out facebook.com/mygenev for more details. Thanks for listening to the Genev podcast series. We welcome your feedback at genev.com. That's GENNEVE.com. You can follow us on Facebook and subscribe to us on iTunes or Stitcher, and you'll never miss an episode. The Genev podcast series is produced by Shannon Perry. Theme music by Smitty. And until next time, watch the Genev website for new stories and offers all dedicated to women's midlife health.